thank you for the invitation to present. I'm going to talk about what I think we've learned from 15 years of monitoring food insecurity in Canada. First, to provide a bit of context to the backdrop for food insecurity in this country. Canada has a series of cash transfer programs, but that support people who are experiencing economic hardship. And what's particular about the situation in Canada is that we focus on cash transfer. We don't have any public funding or only minimal public funding of food assistance programs. We don't have a publicly funded school meal program or any sort of targeted nutrition supplement program. So very, very different than the United States. Our primary safety net is cash transfers. We do have an extensive network of voluntary food charity, but it is minimally supported by our government. That said, the context for food insecurity measurement and monitoring in Canada is very much the context of food charity. You can see here that we started having food banks in Canada in the early 80s. By 1989, they had started to produce national statistics, even though this was a coalition of voluntary organizations. And then by 1997, they were producing annual hunger counts. Just to give you an example of what I mean by that, here's the hunger count released just before the pandemic. Highlights for you. They're telling us the number of organizations that they're surveying, the number of visits that those organizations had in a period of 1 month, and the number of meals that they served. So it's giving a snapshot of the extent of charitable food provisioning in Canada, but calling it a hunger count. It was against that backdrop that we introduced measurement on population surveys, the first one in 1994, and then systematic monitoring in 2005. The impetus was to understand what was going on with all this food charity happening, the assumption being that if someone was seeking food charity, they must be hungry. How big a problem do we have? Since 2005, we've been monitoring food insecurity using this module. This is the module that was developed by the United States Department of Agriculture, and it's routinely used to measure food insecurity in that country. And I'm just giving you here a very simple snapshot of the questions that are asked. Always we're asking about experiences of hardship that are in the context of a lack of money to buy food. The coding of this module is arbitrary. And what you're seeing at the bottom of the screen now is the way that in Canada we code the module. Exactly the same module as the United States, but we're using slightly different thresholds and different language to describe the severity levels. And at the extreme end, severe food insecurity, the thing that used to be called food insecurity with hunger, people actually not eating because of a lack of money for food. Here's what the statistics look like. We had, before the pandemic, 3 cycles of the Canadian Community Health Survey with nationally representative data. And what you can see is the numbers going steadily up. So systematic measurement and monitoring was happening, but the situation was getting worse. In 2018, rather, the Canadian government implemented something called the Poverty Reduction Strategy. And what was special about this for us is that it's the first time we had a poverty reduction strategy at a national level. Food insecurity was included in that strategy as an indicator of deprivation. So you can see at the top here, under the heading of dignity, food insecurity is being flagged as something to be tracked because it's an indication of people not being able to meet their basic need for food. So with that, we got improved measurement. Starting with something called the Canadian Income Survey, that here I'm showing you the dates of data collection. 2 things have changed since we've got this Canadian Income Survey as our tool for monitoring. First of all, we have an annual measurement, which is very important for tracking trends and for analyzing the impact of policy interventions. The other thing that you may have noticed is that the number of people living in food insecure situations has risen. The Canadian Income Survey, I think, is more nationally representative, and I think so we're getting a better picture, and that means first picture of what's happening in terms of the volume of the problem. Note the second bar here. This data collection transcended the outbreak of the COVID-19 pandemic in Canada. And the bulk of the data for this bar is coming from post-pandemic, because the pandemic hit here in March of 2020. What you're seeing is a slight dip. We've yet to do analysis of that dip, but we believe it relates to income supports that were very rapidly rolled out at the federal level to help people who lost work through that time. We know a lot about what is driving food insecurity, or who is food insecure, from all the years of measurement and monitoring we've got. And here is a very cursory summary of what we've come to believe is the problem. Food insecurity rises with decreasing income, but it's not a perfect relationship between food insecurity and income. The other thing we see that is very important are assets. And the primary measurement of assets in Canada is home ownership. So people who are renting their dwelling are much more likely to be food insecure than people who are owning with a mortgage. A few other details that I should share with you. Over the years of monitoring, what's clear is that households with children are more impacted than households without children. The problem is absolutely racialized. While the majority of food insecure people in Canada are white, those who are Black or Indigenous are much, much more likely to be food insecure, even after we adjust for things like income and assets. And this problem is very much a problem of people in the workforce, or people working aged Canadians at least, either in the workforce or unable to garner work. How does it relate to food banks? Because if you remember, that was the impetus to do this in the first place. Well, here you see the comparison of the number of people living in food insecure households versus the number being reported in those annual hunger counts for the comparable years. This is like the picture we have seen every time we have done these comparisons since we first got national measurement. It's only a small fraction of Canadians that use food charity. So using food charity as the lens through which to view this problem is hugely problematic, first and foremost, because it grossly understates the magnitude of the problem. It matters that we have so many Canadians living in food insecure situations because of its associations with health. Again, because of our, 15, 20 years of measurement, we know a lot about the health correlates of food insecurity in Canada. And what I'm showing you on this slide is just really a brief summary of the volumes of literature that have been developed in Canada. We can see relationships between household food insecurity and physical and mental health, chronic diseases, but also infectious diseases, disease management, morbidity, mortality, and healthcare utilization, which is important in Canada because we have a publicly funded healthcare system. Part of the story absolutely is diet, that people in food insecure situations have poorer dietary intakes than people who are food secure. What I'm showing you on the right of this slide is recent data looking at the proportion of energy coming from ultra-processed foods, so an indication of poor dietary intakes. And when we apply statistics to this graph, we absolutely see a significant trend whereby those in more severely food insecure households have a greater proportion on average of energy coming from ultra-processed foods. But what you can see, I'm sure, is that the differences here are not great. Even Canadians in food secure situations don't have terrific diets. So yes, we pick up differences, but they're not gigantic. When we look at household expenditure patterns, we also can see differences. People in food insecure situations on average spend less money on food, which makes sense. They have less money, they have lower incomes typically, they spend less on food. But when we scratch the surface and look at other goods and services, they spend less on everything. Food, now the little red bar at the bottom, it's just a fraction of the difference between these households. When we push further with questionnaires asking about people's ability to meet other basic needs, as soon as we ask something other than food, what we find is people who are in food insecure households are struggling to meet other needs. So more likely to not be able to make rent or mortgage payments, defaulting on utility bills, phone, internet, and prescription medications. If there's any cost associated with receiving prescriptions, these people won't fill them. What moves the needle on food insecurity in Canada? Well, over the years of measurement, we've been able to see a lot in terms of the relationship between food insecurity and public policy. One of the very, very important things about having regular measurement of this problem is that we're able to take a look at enhancements to public policy of any sort and see how food insecurity has shifted in relationship to that. What you can see are Canada's social safety net, child benefits, social assistance benefits, minimum wages, welfare, income tax, improvements to any income source that associates with the household's finances and that impacts people who are low income. It has typically been associated with reductions either in the prevalence and severity of food insecurity. I'm going to end by giving you one quick example. This is a graph of the probability of moderate or severe food insecurity amongst low-income, unattached adults. And these are their ages, starting at 56 and going through to 70. And you can see that this probability drops down. To help you see it, I offer you this. At the point that these people hit 65, their probability of food insecurity drops by more than half. Why? Well, what changes for people in Canada when they turn 65 is that they are entitled to an old age pension. Before 65, the people on this graph were mostly reliant on social assistance or low-waged employment. When they hit 65, now they basically have a guaranteed annual income or a basic income that is indexed to inflation. And for the people on social assistance, at least, the amount of money they're receiving now would be more than double what they had before. As well as that, they've got full pharmacare and many other benefits. What's happened? We see the rates of food insecurity drop. This is an illustration of the way in which food insecurity in our country is intertwined with income-based policies. Okay, to stop there though, in this very quick overview of the problem, what I think the data in Canada have demonstrated is that food insecurity is a potent social determinant of health, not just diet-related conditions, but just about everything. And with that, a determinant of healthcare utilization. There is an abundance of evidence in Canada now that household food insecurity is sensitive to policy interventions that improve financial circumstances, but we are still observing these things without any deliberate efforts in terms of policy to actually reduce food insecurity. So the effects we're finding at this stage are incidental as opposed to policy driven, which we hope we'll see in the future. Thank you.